Since the first index case of COVID-19 was recorded in Nigeria on the 27th of February 2020, the federal government, in a quick response, constituted a committee in collaboration with the National Center for Disease Control (NCDC). This was followed by the government putting down some necessary precautionary measures on ground to avoid this deadly disease.
A lot of effort in risk communication and community engagement, in contact tracing, in case management, case investigation, in points of entry. Those are the people at the port health, airport and seaport. We've done so much to be able to identify suspected cases, investigate them through the PCR testing, and then take them to treatment facilities, treat them while still educating the general public on what they can do to stay safe.
With the continued increase in the number of confirmed cases, one may ask, what could be responsible for this constant rise on the number of confirmed cases?
Of course, it was one person who brought it into the country. And of course, we know the route of transmission is person-to-person spread. And more and more people getting infected. But at a time, it looked like we didn't have so many numbers simply because we didn't have enough testing capacity in the country. But with more laboratories opening up in different states, and the current number of laboratories has gone up to about 23 laboratories all over the country who have the capacity to do testing for COVID-19. It's become a very, very, very important thing that we are testing more people. So that's a big matter. They hear all the information, they see all the statistics, but there's a lot of skepticism and a lot of doubt. I've heard a couple of people say our government is just using this to get the numbers so that they can collect money. I think people like conspiracy theories rather than the reality, and they prefer to live in a world of fantasy. The fact of the matter is that COVID-19 is infecting people on a daily basis. People are actually dying of this disease.
It has been confirmed that quite a number of persons have lost their lives to this deadly disease, as some also survived.
I believe there is COVID. It is real. You know, in Nigeria, many people do see and believe. If they have not seen, they didn't want to believe. But God forbid that we should see before we believe.
As a matter of concern, the federal government, in its wisdom, decided that the state government be saddled with the responsibility to flatten the COVID-19 curve. Hence, the Rivers State government has put in some precautionary measures in the state to curtail the spread of the disease.
There's a lot being done in terms of mobilization of resources, in terms of the expertise. We have one of the most competent teams around the country in Rivers State, doing case management, doing contact tracing, doing risk communication and community engagement, doing laboratory care and services. But above all, the responsibility to stay safe is in the hands of the individual citizens and residents of Rivers State.
With these efforts of the state government, it is believed that in no distant time, there will be a reduction in the number of confirmed cases, if not completely eliminated.